everybody. Dr. Eric Herman, Guru Chiropractor. Peace and love back in 2023 for my first video. This is my patient Dennis. How you doing, sir? Welcome to my office.
Thank you.
Dennis drove in from NYC, New York City. What's that, about a 40-minute, 45-minute drive?
Yeah, 45.
Yeah. Appreciate you taking the ride in. Dennis has got a little bit of a complicated case. I'm going to go into a little bit of details about what's going on now, and then we'll roll into an exam. But before we do that, I want to address one thing. He told me a story. He went to another chiropractor who he wasn't happy with the service and he wasn't happy with the results. We're not going to name names. But basically he was pre-sold 35 visits and he had a prepay and it was like $4,000. And he did all 35 and...
The results were minimal, nothing dramatic. No.
Yeah, so I don't want to go really into like bashing somebody else or saying somebody else is wrong. I have my own opinion about that, but what I will say is I don't do that, okay? And I don't think that's proper doctoring. I do visit-to-visit analysis and decisions, okay? I don't keep people coming in if they're not making progress. After 2 or 3 visits, if we're not seeing progress, we either have to do something else, look a little closer and see if I missed something, or refer you out to a higher level of care. That's proper doctoring. That's the way, in my opinion, and actually standard for doctoring, that's the way it should be. So we're going to take a look and see what's going on with this guy today, and hopefully I can make a difference. I can't promise results. I say that all the time, but I will promise I'm going to do my very best for you.
Great.
Okay?
Thank you.
So you got a little something going on. It's been about a year and a half in your lower back and going down primarily the left leg, in the back, right? And you feel pain in the back and you feel a lot of pulling.
And the hip thing,
and the
pressure on
pressure in the hip. You said when you're trying to stand normal, you feel like your left hip is pushed up.
No, when I stand, I'm comfortable.
Right.
But when I try to move, it feels like my leg is too long.
Too long
it's
on
a
that
weird way of saying it. Yeah,
so there's more pressure on that hip area.
Yeah.
Okay. Well, I mean, not to say I'm excited because I want to help him and I know he's suffering, but this is a complicated case, so I like that because it gives me a good challenge. So let's roll into the exam, okay? So what I want you to do is come sit over here a little bit more, facing me. I'm going to come behind you. I know you're not really complaining much of upper, but I check the whole spine. So I'm going to come behind you, and we're going to check the neck and shoulders first, and then we'll lay you down for the lower back. So can you, is this sitting up as good as you can?
How do you?
Yeah, okay. So, yep, stay right there. Let's see. So I'm just relax your shoulders, good. I'm just going to feel the neck. I want to see what's going on here first. As I come up to the upper part of your neck, there's definitely some jamming going on in the top bone in your neck. You didn't really say anything about it, but this area can cause headaches, jaw problems, obviously neck problems. I'm not trying to wish it on you, but I'm saying what this problem is related to symptom-wise.
That hurt a little when you a little bit.
The right side is more tender, more jammed. Okay, turn your head to the right. Now, see how it kind of stops short right there?
Yeah.
Normal range of motion in the neck should go right about here, like right approximate the shoulder.
Okay.
So it's not perfect, but nobody's perfect. Don't move your body. Oh. Just the neck, no cheating. So see how it stops here? Yeah, it should go there. So the neck also is jammed, and that's tight too. That's a little bit looser on this side, but still too tight. Now bend your head backwards as far as it'll go, not your body, just your neck. See, normal, you should be able to get your face almost parallel to the ceiling, so that's also jammed. You feel jamming when you try to go backwards?
I feel like this is as far as I can go.
As far as you can go.
Yeah.
Any pain when you try to push it?
No,
okay.
stiff.
Stiff. Look, how about this? Important. Any dizziness when you go backwards?
No.
Good. That means it's safe. If you get dizzy, we have to reevaluate. Okay. All right. Chin down now as far as you can go. That's okay, right? Do you feel any pulling here when you bend your chin down?
No, it's pretty comfortable.
Or how about down here? No? Nothing?
A little bit.
When the chin goes down?
Nothing major, yeah.
Yeah, okay, come on up normal. So I'm going to do a little compression test really it's your whole back, but for your neck, I'm going to push down on your head like boom, boom.
Okay.
Tell me if that causes any discomfort here, but also down here. Okay. Stay relaxed. I'm not going to try to do too much, but how'd that feel? Any kind of...
I felt it here.
Like a flare-up, a little discomfort?
No, I just felt it like right here. Like,
okay, like a push-up.
Nothing...
All right, that's normal.
Great.
Now I'm going to do the opposite. I'm going to stretch your neck up
Okay.
and do a little decompression, distraction. Let me know how that feels. Oh, I like that. It feels good.
Okay.
No different,
Got
neutral, or yuck.
Gotcha.
Stay loose as a goose, baby. Just a little stretch. I know there's pressure in your skull, but in general, how did it make you feel? Or even down below?
Felt pretty good, actually.
Like
I
it felt like, got a little relief?
Yeah, that, especially right here on this side.
Okay,
Yeah.
good. So when that happens, this scenario, that tells me the decompression pull is going to do some good for you for sure. That's a little confirmation about that.
Okay.
So that's good. All right, now let's look at that lower back, which is really what I want to do.
Okay.
Face down, put your face between the cushions there. Take your time, no sweat. Hands on the, they get a little, those side cushions there. Let's rest your hands on the side cushions. No
Here?
grabbing, just rest them on the side.
Yeah. Got ya.
Wherever you're comfortable. Come down a little more so your face is like in the middle of the paper.
Okay.
All right, relax. You good?
I'm good.
All right, let me see what's going on. I'm coming down south. I want to just straighten your body out a little bit. So come a little this way. Okay. As you're laying here, up top you got a little torque in your shoulders. The left shoulder's higher than the right. So you got a little bit of this going on, a little higher here. Stay relaxed. Usually the high side is the tighter side. And then when I look in the hips, you also got a rotation to the right and a little what's called a lateral shift to the right and a rotation to the right.
What does that mean?
It means you're from here, about from here down, things are like just leaning a little more to the right.
Okay.
Okay. Now I'm looking at your. See, you were telling me about how this is externally rotated, and it doesn't want to go back. So that's pretty interesting, and it's kind of stuck that way. Legs are even though, which means your hips are level, but you definitely have what's called an external rotated leg and thigh.
Is that the duck thing?
Yeah,
Duck
what you
walk.
call the duck
Yeah,
walk thing.
duck walk.
Usually that comes from here, from the pelvis being out of alignment and pulling too much this way, and it causes this to get stuck this way. So let me do a couple more tests to see. Can you bend your knees really well, or is there problems bending?
My right one pretty good, and then here we go with the
So you can't even get this over this way. Holy macaroni,
No,
that's very interesting. So when I stretch up like this,
ouch.
what's ouch? The lower
Right.
back? The
This
thigh?
thigh,
Hurts?
front
The-
thigh.
Okay,
yeah.
does this put any pressure in your lower back when I do this, or just
no. It's
what, front of thigh?
The right side, bad pull on my thigh.
Right, so when I do this, it hurts more?
Yes.
But nothing in the lower back, just in,
No,
in the
no,
front?
no.
Okay, come down. Let's do it. See how, yeah, you're all off.
Yeah, I can't.
Does that put pressure in your
No,
lower back?
actually, it feels like a stretch. Ouch.
Where? Where's the
So
ouch?
that same thing, like, but
this?
more on the outer side than the right side was kind of dead center in front. This
Yep.
one is here,
Got
a
it.
little to the outer thigh.
Got it. Okay. Got you. Now I'm just going to actually feel the lower back, and it definitely is compressed here. It's very rigid in the lower back. Movement is not that good. When I press in a little bit, is it sore? Or
Feel it. It's a little pinch.
not really?
Yeah,
How
that-
about out this way?
Nothing. I feel it, but that is where that hamstring or whatever
Yeah, where-
is really sensitive.
Like if I push in there, does that hurt?
A little bit. Yeah.
How about out
okay.
here?
No.
No?
No.
How about out this way?
No.
How about here?
A little pain.
Yeah,
A little.
okay.
No.
All right. Let's see how the sacroiliacs are functioning. So I'm going to press down on your tailbone, right?
Okay.
One at a time. Start with this left leg if you can. Keep it as straight as you can. Don't bend at the knee, and lift it up as high as you can.
Straight leg?
Stiff up, yep, as high as you can get it. That's about it?
Yeah,
Okay,
that's
come
it.
down. Does that hurt when you lift, or just...
It's just real tight.
restricted.
Just real tight.
Yeah, try this side. Okay. Obviously that goes more, yeah?
Yeah.
Okay, come down. All right. So, lumbars are definitely compressed, and I'm suspecting you definitely got something big going on here on the left sacroiliac, and possibly even the left hip joint itself. So I'm going to do a couple more orthopedic tests for the hip itself.
Okay.
But first I'm going to check the rest of the spine.
Okay.
So as I come up the back, when I get about here, it's also very rigid. It's very stiff and a little more reverse curve than it should be. It's not reverse curve, but a little more accentuated in the roundness. They call that a hyperkyphosis.
That means it's rounded in or rounded?
Rounded too much towards your back.
Got it.
Too much backwards.
Got it.
Usually what happens is the head pops forward because we're all looking down too much at the phones and stuff.
Right.
And that greatly destabilizes the balance of the weight balance of your body because the human adult male head is 15 to 17 pounds. So when this goes too much forward, the body will try to counterbalance to get your center of gravity as good as possible. This is compensational stuff. It makes the middle back go too much in the reverse direction.
Yep.
Short term, that's good, but for long term, that's not good.
Not good,
No. All right. Neck itself doesn't feel horrible. A little bit tighter on the left side here than on the right, but nothing horrible in the neck. But the transition, the middle back, and then the lumbars, and definitely this right.
Yeah.
Okay, so what I want you to do now is roll over on your back, go face up. If you need to come back down, go up and down, whatever you need to do. Let's see if anything shows up, because that really is unusual how locked up this left leg is. Okay. So, yep, wherever you're comfortable. Are you comfortable with your neck and everything?
Yeah.
Just keep your hands up here.
Okay.
Yeah, okay, let's see. Does that hurt?
A little bit, nothing.
This way? No?
No, that's okay.
Okay. All right, can you keep this as straight as possible and just lift it up? Does it go up? Does that hurt? Anywhere?
A little bit in my knee area.
Okay, front.
Inside.
Anything hurting here, down in this direction?
No, just right on the inner part
Hold
of
it here, hold it here. Now push up. Don't let me push it down. Ready?
Push against your hand?
Yeah, ready? Push up, push up, push up, push up. It's pretty good.
Yeah.
All right, try this one now. Lift as high as you can. All right. Any pain or anything anywhere? Anything
knee.
unusual?
My
knee, but nothing down in the back.
No.
Okay. Push up, push up. Okay, a little bit weak, but nothing horrible. All right, let that come down. Now, bend this. We'll go this way like a cross-legged.
That's the duck thing.
Yeah. Now stay there. Now, I'm not gonna jerk it, but I'm gonna push down a little bit here.
Okay.
Does that hurt? It's just, well, it's definitely stuck.
Yeah.
So this is a positive orthopedic test that there's definitely restriction in the hip joint itself, the ball and socket. In here. Switch legs, cross this one over this one. Will it go? Let's see. Yeah, these are really tight. Now, when I try to push it, do you feel pressure anywhere?
That one I feel right in my
Right
hip.
there?
Yeah,
When I did this side, where did you feel it when I pushed down? Do you want me to do it again?
Yeah, I
Okay.
really
Switch,
didn't
switch.
think about it.
Cross. Okay. Where do you feel that pressure?
In
there?
Here, yeah.
Yeah. Okay. Bring it down. Got it. Okay, so I'm done with the exam. Okay?
Okay.
Here's what I'm working with now as far as diagnosis. I'm not 100% sure. Okay, so there's definitely compression in the lower back. There's also a lot of restriction in your pelvis and your sacroiliac joints and the hip joints, the ball and socket joints in your hips. Without x-ray report or seeing x-rays, that's as far as I can go as far as what's going on in there. I know it's restricted. I do feel that an adjustment will be helpful, but I'm not 100% sure that all of these problems are coming from your spine. I think it probably is also coming from the sacroiliacs and maybe even the hips. Okay? So I'm okay doing adjustment. I don't think it's going to be dangerous, and I think, obviously, I wouldn't do it at all if I didn't think we had any potential for helping you, for improvement. So I think there's still potential to help, but I want to see how your body reacts after the treatment.
Okay.
And then we can talk more. Probably, though, at this point, highly, highly, highly suggest that you go get some x-rays down here.
Okay.
The whole pelvis. I would like to see the hip joints and the lower back and the sacroiliacs and all that, bone-wise, X-ray to see what's going on in the bones. Because something's not right. But I don't have X-ray eyes. I'm pretty good with the hands to feel,
Right.
but there's only so far these could go. So I want to see what's going on inside there.
Right.
So even if you don't choose to come back to me, I highly suggest you go get an X-ray for there to see what's going on inside, because that could help with making the proper diagnosis and you getting the best treatment to help you there.
Right.
Okay? So are you okay the fact that I'm not 100% that this is good, that the symptoms are coming from your lower back, but I still think it's going to help you? Are you still game to do the treatment?
Oh, of course. Yeah, but you know, again, I understand you have to say that because you're a doctor, but it also can be a positive outcome too, right?
Well-
by the adjustment.
Yes. Listen, if I thought no, I would say I can't help you
Okay.
and I would send you home.
So, having gone through what I experienced with the medical side and the bad chiropractors, I'm totally, up for
Yeah.
your suggestions.
All
Of
right,
course.
good. Okay, good. So let's do a ring dinger decompression
Okay.
and a full body adjustment, and then we'll see how your body responds.
Okay.
Okay?
Yeah. Are those kind of things instant? Like, do they get? I'm not saying me, but I mean in general, do they show results fast?
A lot of times yes, sometimes no.
Okay.
But a lot of times, yeah, you watch my videos.
Yeah, I've seen.
A high percentage of people getting up off there, they're like, oh my God, everything,
It's crazy.
So,
yeah.
yes, but not all the time.
Okay. Fair,
Not 100%.
Fair answer.
Okay, so I'm ready to start treating.
Let's
What I
go.
want you to do is go back on your belly, go face back down right here. Can you need help?
No.
You good? All right. I'm gonna do a little loosening up for you, a little stretch out, and a little massage, and then we're gonna go right into the pull and see how you do. Your job: stay loose and relax as best as you can, and verbally give me a heads up if anything I'm doing to you doesn't feel good.
Got
okay?
it, got it.
All right,
Thank
stay
you.
loose as a goose, baby. We're just gonna do a little stretching. We'll see how you do. You don't go to a lot of doctors, though, do you?
What do you mean?
Are you like anti-going to medical doctors?
No,
and
no.
stuff?
I mean,
Okay, good.
like I went through the orthopedic guy. I thought,
Oh, that's right. That's right. You told
but
me
when
that.
I saw what they do, how they replace knees on YouTube, I said, no way.
It's funny. Not funny. It's really not funny. It's very interesting, though. You told me that he didn't even barely touch you.
No, that's a
And then right away he went to start giving you a consult about knee replacement.
That is really the truth.
Okay, so wait. They never took X-rays of your knees,
No.
and he's already telling you he
Yes,
thinks you need.
yes, first visit, he showed me a plastic knee. That's the truth.
That is malpractice as
That
far
is
as
the
I'm
God's
concerned.
truth. Yeah.
As far as I'm concerned, that's malpractice. So, sounds like. Listen, I don't say bad about all doctors. They're not. It's not true. There's a lot of great doctors
Yes,
out there.
yeah,
Hello, but there are some not good ones. And the story you told me, I wouldn't go back to that guy or that girl.
That was the last time I saw him.
But I was taught in grad school, in medical school, anytime you have a major issue and you're going to doctors for evaluations and consults and stuff, you definitely go to at least 3. Get 3 different opinions
Right.
before you make a decision. And don't tell the other doctors what the first doctor said.
Right.
Let them make a clean, fresh diagnosis without you giving them any input from somebody else.
That is the first movement, that upward, that I felt a little pull, like a little bad stretch.
Like, didn't feel good?
Yeah, but it's the first of all that you're doing. It's very relaxing, but that hurt a little.
Okay, got it.
That upward motion.
Yeah, that's that left side.
Yeah. Ouch.
Ouch in here?
Lower. That right there. Oh boy. Ow. Oh. Yep. That's it.
Alright, I'm going to do a little bit more with the massager.
Okay. Oh.
If you don't like it, let me know, but everybody usually loves this damn thing.
Yeah, very nice. All right.
Ouch?
No. It's sore. So.
Yeah, that's what I mean,
Feels
soreness?
good. Yeah, it's good.
But it feels good?
Yeah,
Like you
yeah,
make it really? Okay, good.
yeah. Oh. You know, like when you, after a good workout, you stretch, like, it's a good stretch.
Okay, good. Yeah, I get you. I tell my patients there's two different types of pain. There's pain but keep going, and there's pain, get the F off me. Yeah, right? Am I right or am I right?
You're right.
Well, if anything I'm doing to you creates a get the F off me, let me know right away. Okay?
I will, but thank you.
Yeah. Yeah. Yeah, you need this.
Oh, yeah, that's amazing. Oh.
I get it.
Oh, man,
I need one. I'm way overdue for me.
nice.
I've been a bad patient. Overdue for my adjustment, and I'm overdue for my massage.
Oh, man. That is nice.
Oh.
Oh.
Ah.
Yeah.
Yeah, there's definitely something going on in here. Definitely something going on right here in the hip. So that does not feel normal. So I would 100% recommend going and getting some x-rays.
Okay.
Huh?
Okay.
Yep. All right, so we're gonna do a decompression pulse. So come on up on your feet, take your time, no rush, and we're going into the room back behind. Whatever you gotta do to get up safely and well.
Just one quick question. The lower back, is that a spine thing, a muscle thing, or everything? You know, but you said it's all locked up on
The lower back definitely has compression. So
meaning the spine.
the lumbar spine, meaning the lower back, the part of your spine that's in your lower back here,
Right.
is very compressed and rigid. So there is abnormality there,
Right.
which justifies doing an adjustment. That's why we're going
Right.
to do it. But there's also other things going on, and I really think there's something bone-wise abnormal in your left hip.
Oh.
That's why I really want you to get an X-ray so
Okay.
they can see what's
Okay.
going on in there. So come on up, though. Let's go do a pull. Take your time. Don't trip coming through here.
Well, you know what? That's the farthest I've walked in a week.
Without.
Yeah.
Okay, so you feel like you're walking a little better? That's promising. Just from the massage?
Yeah.
All right, good.
Get it.
Cross the fingers. Head here on your back, face up. Put your head on the face.
Oh, is this the
The pull. The decompression
ring
pull.
dinger?
Yup.
Oh,
Ring
boy,
dinger, baby.
This is exciting.
Come on down about 2 inches. Is your head okay, or you need
I don't
something
know.
underneath to let it
you
drop?
tell me.
I mean, can you let it hit the table?
Yeah.
Does it feel uncomfortable or okay?
Yeah, I don't know. I guess it's okay. I mean, from what I remember of your video, do you need that to be?
I'm just saying,
looser?
is that more comfortable?
Yes.
We'll make it easy. We'll make
Okay.
it simple. So now I gotta keep your hands up here. Now I gotta feel your hips. Come down like 2 inches. Scoot down towards your feet. A little more, a little more, a little more. Right there. Perfect. Now keep your hands back up there. Okay. Up here. Yep. So now I'm gonna raise the table up first, and then we're gonna lift your legs up if they'll bend properly. We'll see about that one.
Me, myself?
The
or-
table lifts up your legs. So
Okay.
give me a sec. We'll help. We'll do that. Of course, I'm gonna get the. So, bring them halfway here, and now the table's gonna raise them up all the way. Just let the
Gotcha.
the platform come up and
Gotcha.
lift your legs. If it,
All right.
don't wiggle.
Okay.
Makes it go back down, and then
Sorry.
I get mad. Not at you. I get mad at the table, not at you. Okay. No, they're laying pretty flat. You feel okay there in this position first?
Yeah, it's pretty comfortable.
Okay. Next, what we have to do is pin you in really tight here above your hip bones, because the idea of this whole treatment is when I pull your neck, I want your body to stop short. Plus, the table's bolted to the concrete slab, so that doesn't go anywhere. So when I pull, nothing moves except for the only thing left that can move
Got it.
is your spine.
Got it.
That's what gives the big release. Coming around. If it's too tight or causes any weird pain with the pinning, let me know. It's going to be a little uncomfortable, but if it's too tight for you, you got to let me know. I won't
Okay.
loosen it. Can you handle this tightness?
Yeah,
Okay.
not that bad.
All right. Now, let me have your hands back to me. This is not the treatment. This is just pulling out any residual slack before I do the real pull. So it's prep. Oh, you're pinned good. All right. Stay relaxed now. Hands anywhere they're comfortable except for grabbing these bars. I don't like when you grab the bars.
Got it.
Now I'm going to get the towel around your neck that helps give me a better grip. 'Cause my hands are too small.
Okay.
Okay, lift up your neck for a sec. All right, come down, come down. So this goes around your throat, but really it grabs the back of your skull and your jaw like this.
Okay.
Good, good. So your job is 2 things. Number 1, keep your teeth touching together, but don't bite hard because then it makes things too tight here and you don't get a good enough release. Just keep them touching so when I pull you don't bang a tooth. Bang your teeth together, right? Chin down slightly so we stay away from your throat. And that's it. Stay relaxed right here as best you can, and I'm going to do everything else. Are you ready, Freddie?
Yes.
Okay, give me 5 seconds. I'm going to just center myself, and then we're going to come in and do it. Stay loose as you can. Okay. First, I'm getting a grip, so nothing's happening just yet. I want you to bring your chin down a little more towards your feet, right? Stay relaxed. Wiggle your left toe. And boom.
I'm ready.
It's over. She's just like, I'm ready, but I'm like, it's over. Now, how did that feel? Did you feel things release?
I felt my neck pretty good. Like, I felt
Like pop,
in
pop,
my
pop?
neck, yeah.
Good.
And this, wow. That's,
Looser?
could you grab that and just pull me? Oh my God.
So you got more flexibility there.
You know, again, since I haven't been to the gym, I used to, keep flex, but I knew my upper back was tight.
Did you feel anything in the lower back release?
I felt a little bit straight up my back.
Yeah, that's
lower,
what that's what we're looking for.
Yeah,
Okay.
that was-
So let me bring it out. Don't get up too quick. Stay right there. Stay here. Just stay relaxed. Because I'm going to do a little more releasing your neck before you even get off this table. So just let the table
Oh,
come down.
wow.
Well, the top half did good,
Yeah.
for sure.
So is there a ring dinger for the lower?
Well, this does the whole thing. Is a ring. I mean, if you feel like it felt like it didn't get the lower as good,
No.
we could do a second pull. It's called the double dinger.
No. Not my first time.
Yeah, I know. Stay relaxed. I want to do a little more twist here. You ready, or you need time?
Yeah, no, I'm good.
Stay loose. Good. Nothing major.
Oh, that was good.
Good. Now, I'm just
Wow.
curious. Let your head come down. Does that feel more comfortable without the towel even? So that pulled out a lot of that jamming that was keeping your head
I
forward.
wasn't expecting that.
Isn't that good?
That click. That's the old school chiropractor
This
that I
is
used to get.
Exactly.
Oh my God.
I'm trying to keep it alive. That's what I'm trying. That's my mission.
Oh,
Keep an old school chiropractic.
that was really good, man.
Okay, done here. So when you're ready, you can make your way back up on your feet. If you need my help, I'm right here. You just let me
Can
know.
I just lay here like 1 minute?
Yes.
Feels just.
When you're ready.
No,
you
I'm
just-
fine. I'm
no
fine.
rush.
I'm just.
No rush. But
Can
when,
you
and
pull
when
that arm again? It just felt so good. Like slow. Oh man.
Wait. Do a little more.
Oh,
Look at that.
God, it's amazing.
Yeah.
That-
So that helped your spine, and the upper. When the upper spine releases, it greatly affects the shoulder in a good
Yeah,
way.
no, that was the biggest star so far.
Amen.
Wow.
When you stand up, stop for a second, kind of check in with your body as you're standing. When you're standing.
Right. Oh yeah.
And
I'll let you know.
let us know.
What's up.
So, good. At least you got improvement there, so that makes me happy for you.
It's a little stiff, but
What?
it's really good.
Okay, you notice an improvement?
Oh yes.
Alright.
Again, see that move. You see how I'm walking? That feels more like my back than my hip. Does that make sense?
Yeah.
You know, I feel a little pull here, but I feel more like this awkward walking
Because of the
yeah,
lower back.
Yeah.
All right, well,
Wow.
we're gonna do more on the lower back right now. As soon as you lay back down here.
Right now?
We're gonna hell yeah! I'm not done.
Oh.
Face back down. I got more to do, baby. Let's get.
I'm not going anywhere.
No, we're gonna do some more good release for everything, the whole rest of the spine. So, yep, keep those up there. Now, move your body down about an inch or two towards your feet. Right there. Stay there. Now, we're gonna do more releasing here. Well, really all the way up, but we'll start here from this perspective, pushing this way to release.
Okay.
It's called the drop technique. The belly part will drop down. Here it comes. Whee! This part pops up, and when I press on you, it's gonna go boom. So I'm gonna go boom, 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 boom.
Okay.
Stay loose and just let me know if that doesn't feel right. This is gonna release the lumbars even better. Okay?
Yeah.
Good. Nice. Oh yeah. Nice. Coming around the other side. Good. Good. A little bit more. Nice. Okay. So, restriction-wise, rigidity, it's a lot less. Which means it's moving better here. I don't know, let's see how things go when we try to bend again. Try to bend. This one,
Right here.
yeah, you start feeling it in the hips.
Yeah, like.
Any different than before when we did it?
A
Or?
little less pulling, but I still feel it right in the front.
See, the fact that this leg goes this way and it's stuck,
Uh-huh.
that's almost certainly coming from the ball and socket in your hip.
Right.
So, we already talked about it. I highly recommend you go get an x-ray down there.
Okay.
The lower back is doing better. Good. 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 Okay, now we're going to do a little bit more coming up this way, okay?
Okay.
Stay loose as a goose. Let me know if it don't feel right. Good. Too much or okay?
Oh, it's good.
Good. A little bit more for the lower neck. So can you look up as high as you can? Tilt your ear. Stay relaxed. Good.
Oh.
Back in the middle. You okay?
Yeah. That was a stretch.
Now we're doing. Hold on. Wait for me. Wait for the doctor. Now come up first. Now side.
Oh.
Good.
Ouch.
Sorry. Sorry.
That was the first one that hurt though. All this stuff felt good.
Good. Good. Gonna do a little more gentle dropping through here for see if we can get a little more mobility in the transition.
Okay.
Stay loose down here. Don't move too much.
Okay.
Oh, gotta tighten it. Tension. Okay, relax. You okay?
Woo.
Yeah, that was. We'll leave it there. Now. Good. All right. When you're ready, what I want you to do is flip over on your back, face up.
Okay.
Need my help? No.
No.
All right, let me have you.
Just give me 1 second.
Yep.
Okay.
When you're ready, let me have your hands to me, back to me. So we're gonna do a little more stretch like we did that last time,
Okay, good.
and then a little bit of a tug too.
Okay.
See if we can get a little more release in the lower back. Relax. And boom.
Nice.
All right, now rest them anywhere you want.
I
Anywhere where they're
I
comfortable.
moved up a lot. Should I move?
Yeah, you can stay there if you're comfortable.
I mean, when you pull me, I move.
Yeah, you're fine there
Okay.
if you're comfortable.
I'm good. Yep.
Okay. Now what I'm gonna do is a little tug at the ankle.
Okay.
Typically that releases the ankle joint, maybe even a little in the knee, maybe even up even in the hip.
Okay.
Your job, just stay loose.
Okay.
Just let me have it loose. Drop it in my hands, drop, loose and floppy, good. Relax it. Nice. Back up. Woo. Now this one, drop it in my hands, loose, loose. There we go, got a good release there.
That was good.
Let's see. We'll do a little release here at the knee.
Okay.
Just, let me see if I can get it. Relax it. There we go, nothing too crazy. All right. All right. When you're ready, sit up. If you need my help, I'm here. Swing around, face that way.
Okay.
All right. What's the matter? You cramping up?
No, I'm just, I just feel like I want to stretch.
You're checking it out?
Feels good, yeah.
It's looser up there.
Yeah, no,
big
the
time
back,
here.
that's huge,
Yeah.
really. The back feels so good. I haven't been able to do that, so I'm enjoying it.
Amen. Enjoy it.
Thank you.
What we're going to finish off with is I'm going to adjust the shoulder joint, the elbows, the wrist, and the fingers. Both sides, and we'll be done for today. Okay? Start on this side first. Bend up like a this. Just this one here in front of you. Yep. What I have to do is hug around you.
Okay.
Get both hands underneath your elbow and do a little pop this way.
Okay. Am I sitting good?
Yep. Just stay as loose as you can. Don't punch yourself in the face. Relax it. Good. Give me this side. Elbow down. Elbow down. Good. Coming around. Little bit in the elbow. Nothing crazy. Nope. Drop it in my hands. Give it to me. Loose. Loose. Drop. Drop. Loose. 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 Then. Yeah. Good. Now loose floppy wrist. Loose. Bend your elbow. Yeah. Loose. Loose floppy. Loose. Good. Good.
Wow.
Relax. Pull towards you a little bit. Pull. Good. Pop. You pop your knuckles a lot. No?
I haven't done it in a while. I'm
Drop it in my
surprised.
hands. Drop, flop it, loose. Good. A little crunchy there. Flop your wrist. Whoa, that was a big
I
one.
heard that one.
Good. Stay loose. Good. Good. And done. Now,
Thank you.
how does it feel overall? Give us an overall report of how you're doing.
For one time, one visit,
Yeah.
amazing.
Good.
With this issue, I wasn't able to go to the gym, but I have weights at home, and it just didn't feel right. I couldn't do even this. I couldn't do this, literally.
You couldn't even get your hands up
like
there?
Here. Yeah, like I could, but it's not the weight. It was the movement. I was so stiff. I couldn't. My hands were like here, and
Yeah.
I just couldn't get that. And for one visit, that's
Yeah.
really
Okay.
amazing.
Good.
Thank you.
Anything going on better with the lower? Can you notice or not? I'm not trying to fish for compliments or anything, but I just
I
want to
know
see.
this sounds crazy, but I really wasn't able to walk 3 steps without the crutches.
Okay.
And the fact that I'm doing this it's pretty amazing.
Okay, good. That tells
And
me
I
there's some
feel
hope for
so-
down there.
Yeah.
No,
I will get the X-ray.
I really want to emphasize.
I agree with that.
highly recommend. There's something
So maybe
unusual
it'll help
in
you.
the hard tissue, in the
Right.
bone, in that hip, and I don't know what because I can't see. We need to look
you
closer.
have to work on that, see if you can see.
I don't know.
But other than
listen, honestly, I don't want to. I don't want this to sound like I'm being controlling, but I won't treat you again until I see an X-ray report or at least X-rays for down there. I really want to see it because I want to make sure you're safe and I'm doing the right thing for you.
So you're saying I can't come for another visit until you get X-rays in?
I'd like to really see X-rays down there before I do more work down there.
Okay.
Why? Go get X-rays. X-rays are not that expensive.
Well,
And
why
if you want, I could write you a script for them, but it's for a local place here. I don't know where you want to go for them. But
I can get an X-ray, but
listen, it's not because I'm being controlling.
No.
I just want to make sure I'm not doing the wrong thing for you down there and making it worse.
Well,
and without
how
seeing an
about this?
X-ray,
How about this?
I don't feel that comfortable doing more treatment.
well, how about this? Do one more treatment, and then
He wants to barter with me.
and
Okay,
then
he wants to negotiate.
I won't argue with you. Is that fair?
As long as
Because if I feel-
if you don't take a note, if you don't take a nosedive down there, meaning if it
Right.
doesn't get really worse from
Right.
this treatment, I'll consider that. But that's it. One.
I promise.
I'm a man of my word, and I'm
Right.
not going to go further than that because it's the right thing
But
to
you
do.
have to be open-minded too. That if I come back and after the second visit you feel that this is getting better,
If something dramatically
we'll leave it open.
changes,
I don't.
if a miracle happens and something dramatically changes with how that feels,
Right.
I will be open to reconsider.
Okay, fair enough.
All right.
Okay,
Good job.
you heard-
Listen,
it's on tape,
you did
right?
well. If you're sore, I would definitely use ice, but stay away from heat down there. I'm just saying, anywhere.
Yeah.
A lot of people get sore. Take it easy today. No, don't really try to push your body, even though you're feeling better. Some people feel better and they want to get out there and be Hercules.
I can't.
Don't do that. Walking a little walk is good if you feel good about it.
Yeah.
But don't do any heavy duty pushing with your body quite yet.
I won't.
Wait 3 or 4 days, see how this pans out, and then if you decide it's good and you want to come back for that second one,
Right.
then reach out to Zach when
Right.
you're ready and get back in. Try to get back maybe next week or the week after,
Yeah.
so we could do another follow-up before things start reversing
Perfect.
back to the other way.
And then if things are not good and you really don't, I won't fight you on that. I will get the X.
Deal. All right, so let's say goodbye to the audience. So, goodbye. No.
Thank you.
This is Dr. Eric Herman, Guru Chiropractor. Dennis, who
Dennis.
I feel is on the mend somewhat.
Yeah.
We're signing off. Peace and love to everybody. Trying to perpetuate true chiropractic, keep it alive on the planet so that people can get well and use it the way it's supposed to be used. If you like this and you relate to anything we're doing here or any of my other videos and you feel like, oh, I think I could use that, and you're local within the tri-state area or you want to take a drive or even a plane ride, I'm here for you 100% from my heart, doing it the right way with integrity as much as possible. Love and appreciate everybody. Off till next time. Peace and love.